This week, we are going to hit up the APSF newsletter archives for some important patient safety topics. The February 2017 APSF newsletter has a great article on distractions in the operating room and whether they are a liability for the anesthesia professional. There can be significant challenges in defending anesthesia professionals during litigation involving allegations of distraction. This case from Preferred Physicians Medical involved an anesthesia professional taking care of a patient undergoing an ablation for atrial fibrillation in the cardiac catheterization laboratory. The patient's ejection fraction was 40 to 45%. 4 minutes into the procedure, the patient's blood pressure dropped into the 80s and continued to be very labile throughout the case, ranging from 60s to 110s, with supportive care, fluids, and inotropes from the anesthesia professional, who also communicated the hemodynamics to the cardiologist. Unfortunately, a few hours into the case, the patient's blood pressure dropped into the 50s and did not respond to any further medications. A code was then called. The cardiologist suspected cardiac tamponade, and a successful pericardiocentesis was performed after a few attempts. Unfortunately, the patient never recovered neurologically from the event and passed away several days later. The patient's family sued the anesthesia professional, cardiologist, and hospital, alleging that the anesthesia professional was distracted during the case. While the defense experts concurred with the anesthesia professional's management, the internet log of the computer in the cath lab confirmed that the internet was accessed several times during the procedure for non-patient care-related reasons, the last of which was 8 minutes before the code. Because of this evidence, the anesthesia professional consented to a settlement. So how should we handle distractions in the OR? Stay tuned for part 2 of this series, where we will examine the evidence on how pervasive this patient safety problem is. You can also read the entire case and article in the February 2017 APSF newsletter.